Good morning, everyone, and welcome to our webinar on multiple sclerosis symptoms and management tips. Your presenter today will be Jodi Haartsen, and I am your facilitator, and my name is Peter Butler. In the spirit of reconciliation, MS Limited acknowledges the traditional custodians of the land we are meeting on today, and we pay our respects to their elders past, present, and emerging. We also acknowledge our gratitude that we share this land today, our sorrow for the cost of that sharing, and our hope and belief that together we can shift to a place of equity, justice, and partnership. So I'll just introduce you to our presenter today, Jodi. She has over 20 years experience in working with people with MS and other neurological conditions. She's the Executive Manager of Client Engagement and Wellbeing here at MSL. She's a registered nurse and also an MS nurse practitioner. She, on top of that, is a member of the Global MS Brain Health Steering Committee, and she actually this year quite recently won the Global MS Brain Healthcare Professional Award, which was a great achievement. So I'll now pass you over to Jodi.
We all good? Okay. Yep. Yes, I do care very much about brain health, so it was great to win that award, but also be involved in that global committee in brain health is fantastic. But today, it's great to be able to come and have a chat to you about the thing that in my 20 years was the most complicated part of managing MS was definitely supporting people and partnering with people to help manage their MS symptoms. And so unquestionably, there was, it's complex and it's complicated. And so I could probably sit here and talk about managing MS symptoms all day, but I'll narrow it down to a quick 30-minute step through of some of the things I've learned along the way in my years. And I guess when we think about MS symptoms, everyone does experience them individually. Like any symptoms, a headache is experienced very differently from each individual from a headache, but there's commonalities that are within that you sort of start to understand, and they help a lot when you partner with people to say, how can we best manage symptoms? Where's the common points that can help guide to create then an individual plan? So I'm going to talk about those commonalities more than I am about the individuality of it. But as I said, I understand that those commonalities can only be used to help you as sort of understanding what's going to be the best individual plan for you. And that's something that in managing MS symptoms, sometimes you nail it really quickly, and that's fantastic that people are able to sort of manage those symptoms effectively with different strategies. And other times it can be a really difficult journey and needs lots of support from your support crew and the people around you, and also the healthcare professionals. So let's get going on that. So I'll just start off very quickly. The brain controls everything, and the spine, and it all goes through the spine, and it's very complicated. And if we have a quick look at the anatomy of the brain, so quickly, you'll see all the squishy parts, all the folded looking parts. They're the main lobes of the brain, and then in the middle there is a space that's called the ventricles, and they contain fluid. The darkish part on this picture is fluid, and so that's sort of in the middle there, help cushioning the brain. And then the one that sort of looks like a leaf is the cerebellum, and that controls coordination. And then the white sort of blob down in line with your nose is what's called the brain stem. The two configurations there are the brain stem. And essentially all the nerve pathways that are created in your brain move down the brain stem and then go into the spinal cord to control your body. So the brainstem is a filter of lots of information, and that's sort of, I'm giving you that quick snapshot so that we can help understand a little bit about the symptoms when I talk about them, but also because it's an incredibly complex, MS is a incredibly complex disease because of all the, so many nerves in the brain can be affected. So let's talk a little bit. This is a group of people from Wellington, actually, but there's actually this slide is used a lot from other MS sites as well too, and they're sort of taking a picture at all the different types of symptoms in MS, but also how common they are. And you can see the fatigue, numbness, tingling, muscle spasms and walking difficulty, pain, they're all rated very highly and are very common in people with MS. When you look from a broad spectrum, when they're looking at how many people experience these symptoms, these are the ones that in some studies come up most commonly. So in terms of, there's some I'd sort of challenge. I think that cognitive dysfunction is higher than 49%, and depending on what study you read, you can see that that's much more prevalent, and bladder dysfunction the same. Headache got a little star because there's still some debate about how common or whether headache is a symptom of MS or not. And it's split about whether that's agreed or disagreed on, but I tend to sort of think that sometimes if you lump a symptom in with MS and say it's because of MS, you forget to treat it independently. So there's a bit of debate in all of these, but roughly saying they are the top symptoms. And I'm going to talk today about the top symptoms, the most commonly experienced symptoms. And as I said, we could talk all day about each one of these. So I'll start off with vision issues. Now, whilst vision issues isn't the top symptom that people with MS experience, many do, and it's the most common presentation. And this is a really good picture of optic neuritis. One of my things as a nurse when I was talking to people with vision loss was also that your red's not as red as it normally is, and your yellow's not as yellow as it normally is. So I really like this picture that it draws out not only the blurring, which can be quite, here it's obvious, but it can be quite subtle, but it's also sort of that weakening of colours that sometimes can be a first sort of trigger to vision issues. And this a symptom is called optic neuritis. The optic nerve starts at the brainstem, which we talked about, and moves right through the middle part of the brain to sort of, and the area where MS can quite commonly impact the nerves. And that's why it's a common symptom as a start of MS. Often it resolves itself. So most people don't, in the initial stages, don't live with permanent issues, unfortunately. But there are other vision issues that can happen with people with MS as well too. Optic neuritis often comes along with eye pain. It's normally only in the one eye that's affected, and normally in MS it's only one eye that's affected. Diminished visual acuity. Many people with MS get very familiar with vision charts. Some really clever people can memorise them off by heart, but that sort of defeats the purpose of having them done. But losing that clarity and that's visual acuity can be part of MS, again, usually only in one eye. Blind spots can happen, and you can see here a blank spot, that's called a scotoma. People can have blurred vision, again, often associated with optic neuritis, but not always. And a jerking appearance of the objects of the eye can also occur where one object looks like it's repeated on a number of occasions, and also double vision. And sometimes when you're looking at people's eyes, they ideally move in synchronicity. The pupils and the eyeballs move in synchronicity with each other. And so what can happen is that when some people with MS, they don't move in synchronicity anymore, and that can cause this jerking appearance of objects and the double vision that can be very problematic, as you can imagine. So there's a number of different reasons or areas of the brain that can be impacted that result in these symptom problems. And so one of these that is the optic nerve. So the optic nerve I've just talked about, that controls vision, and symptoms can include eye pain, decreased vision, that visual acuity, and that's often associated with optic neuritis. The brainstem is the one that controls the eye movement, and that's when I talked about how you can have those eyes no longer moving in synchronicity with each other and results in you can see two objects at once or jerking movement of the eyes. The part of the brain called the cerebellum, which controls balance and coordination, that's got a really important role in coordinating eye movements as well too. And so that can cause a visual deficit in MS called nystagmus. And these are all, I said they're probably more common than what the initial chart showed in my experience, and can really create difficulties for people as they try and negotiate, life with MS. In terms of what we can do about it, so initially with optic neuritis, it does tend to respond quite well to a short dose of steroids. So what steroids are is a really potent anti-inflammatory, and that reduces the inflammation of the optic nerve, which is clearly visible on MRI most of the time, that inflammation of the optic nerve is. And then, so that's sort of the most common way of treating early optic neuritis. It doesn't necessarily impact the other eye movement and vision issues unless it's associated with a relapse. So they can also resolve if there's a if the relapse resolves as the swelling resolves with the relapse. Other things that are trialled from a medical perspective can be certain muscle relaxants and anti-seizure medications. Generally, in my experience, they may be worth a try, but they're often not that effective, and certainly sort of not used all that commonly. But certainly something, you know, when you're really pushing all the boundaries and trying to work out, as I said, that individualised plan for you, it's something that people would consider. Lots of, in terms of the other area, that's sort of about what you can do and other things that might be considered. So one of the important things is, as always, not to blame everything on MS. So sometimes visual problems can have another cause, so it's worthwhile just investigating. Just, you know, I often send people down to Specsavers because they do a pretty good job for free, and just to have a look at your eyes and make sure that there's nothing else that is the problem. Small changes like increasing the light at home, increasing the contrast of things around you. Some people need to put some red dots around things so they can see them more clearly, things that they use every day. Putting, you know, red and yellow are the most obvious colours that stand out, so that can be helpful on doorways and steps. Also, larger fonts can be used. Luckily, telephones use larger fonts now, so we can adjust the font. Carrying a torch if you need to, because often, of course, the vision is mostly affected at night, and because particularly if you have the double vision and the jerky movements of the eye, the area that is vulnerable is that cerebellum, and that also controls balance. So at night you sort of lose all your visual cues to be able to balance, but also the other integrated parts of your body that help you understand where you are in space too. So you know, leaving a light on at night and stuff. That I think the most common time of falls for people with MS was at night. In my experience, probably not in research, but they often happened at night. Occupational therapy and vision specialists can often be helpful as well too. If it's something that's really bothersome for people, we would often engage ophthalmologists, and we had a certain group that we used a lot in clinic, and most sort of larger MS services do sort of have certain services that they refer to a lot, so they get good experience with MS and able to understand what can can and can't be done. Eye patches are, you know, really used quite sparingly. They're not really that helpful in many visual problems with people with MS, but sometimes they really are, you know, they're really very useful and worthwhile. So again, that usually is those decisions are usually made in conjunction with specialists, eye specialists. So the next common symptom that really there's very few people who don't experience fatigue with MS. I think it gets up to about 85 to 95% of people with MS live with fatigue. And one of the most common, I guess, analogies for fatigue is a reduced battery. And if battery was, you know, if your energy was a battery, the pathological condition of MS reduces that energy. Now, it's not really very well understood why. It would be great if there was an answer to that, but because then we could work towards a better treatment for fatigue. A lot of treatment around fatigue now rests in lifestyle changes that we'll talk about shortly. But a lot of the features anyone living with MS would be familiar with those features of fatigue. Fatigue often worsens with relapses. It can actually be the first sign of a relapse if the fatigue really increases. It's associated with heat and infection. That's also when your fatigue will get worse. As I said, it's not really very well understood. There are lots of impacts on fatigue, and that's sort of part of the puzzle to be able to sort that out. It's also not necessarily correlated well with MRI, and an EDSS is a measurement that neurologists use to look at other factors of your disability. So your walking will, struggling with walking will naturally increase your fatigue, but it doesn't always match that way. It doesn't always mean the more lesions equals the more fatigue. And so that part, ties back into the part that is not well understood. Often you'll hear about fatigue described as primary and secondary fatigue. So if we look at all the different things that impact on pathological fatigue, we can see that mood is very highly associated, and the psychological health is associated with fatigue. Sleep disorders, there are some that really impact MS symptoms that really impact sleep, and it's one area that you can really work on to be able to improve fatigue. And it might just, everything is about just putting a little bit more into that battery bank, so that knowing that the battery bank is less with MS, unfortunate as that is, there are things that we can, that we know that can help that. And investigating sleep and understanding sleep and trying to kind of look at sleep apnea, treating restless leg syndrome, bladder dysfunction that gets people up overnight, all night, all those things, menopause, all those things that sort of contribute to poor sleeping for people. Stress and anxiety contributes to poor sleeping. Getting a good sleep is just what's so important, but particularly when you're having fatigue. Other features that impact it are, as I said, relapses, cognitive impairment, physical disability. They're all going to impact fatigue as well. Infections are going to worsen people's with MS fatigue. Increasing smoking has been associated with poor outcomes in every area or in every symptom, but also some of the choices, social choices that you make if you're a party animal and go out all night, and they can all increase your fatigue. Other things, even isolation in itself, which sort of links in with psychological help, can all sort of contribute to fatigue. And a lot of these things we talk about as secondary, they're secondary fatigue. So they're the things that are more controllable. The primary fatigue in MS is the fatigue that has a pathophysiological cause, but that's the part that we don't really understand. And these are all the areas where I guess there's opportunity to try and help put things back into the battery. This was a really interesting little study quickly that they did in 2012, but I found it really interesting. They just sent out to the MS Blogspot, just said, hey, let's have a look at all you people and see when your MS fatigue sort of impacts you the most. And surprisingly, I mean, I really expected it to be evening. I thought everyone would say evening because that's at the end of the day. But the coming and going through the day and night, was 36%, which was quite high, and sort of really create an opportunity to think about, hey, that's going to show that it's another thing, I guess, that makes it even harder when you're living with it, because you never quite can be sure when it's going to impact, and that can be something that can be a really challenging aspect about fatigue as well. So in terms of the medications, there are medications that have been trialled. Some of these are not available in Australia for use. Ritalin and dexedrine are one of those, two of those, and also Nuvigil. So these are American ones, but I think it's worth sort of, lots of people ask questions about these and asked me questions about these, saying, why aren't these available and what are the, are they usable, feasible? Now, there are very good reasons why they're not available in Australia, because Australia generally has a very generous system in making medications accessible to people, and a lot of them have really significant side effects. So the most common ones used in Australia would be modafinil and amantadine, and they're, the research has shown that for some people they're helpful, but for the majority of people they're not. And taking them also has consequences on lifestyle. So they're worth sort of having a good discussion with it's okay to bring them up. It's okay to bring these up with your healthcare team and say, tell me about these. What's your experience with them? I'm sharing my personal experience with them, and that's over 20 years I saw them overall. It would be rare that someone had benefit from them, but it's okay to have the discussion. I think more people benefited from treating their depression. It was an area of controllable than they did from taking medications purely for fatigue. But as I said, there were people who it was found it to be just a little bit useful, and just a little bit useful was enough for them to see the benefit of it and to consider the risks associated with it, because all medications have a risk. So you'll see when I talk about lifestyle that really exercise trumps so many things. It's been shown again and again in every research study to be able to improve symptom management. And then the rest of them, I'm sure many are familiar with healthy diet, relaxation, reducing alcohol. And I don't say that with any sort of, they really can make a difference. It just, I guess that it takes effort, and in a lot of cases habit and behavioural change, and that's tough to do. So so there was a facets program that we run through MSL, and also done in the UK as well too, and that program just was a 6-week online program that really looked at people's using these behavioural techniques and other tips and tricks, I guess, from occupational therapists to be able to manage their fatigue, and it showed really good results with that. But you know, it's really hard to do, don't I know it? So these are some of the little things that you can do every day when you're running a bit on empty. And these are the things that you know, they sort of talked about. But as I said, a lot of them are tough when you've got to do, you know, using your energy judiciously. Some people said, I prefer to just go hammer and tongs until the morning, and then I'll sleep in the afternoon. So everyone, you know, these are common things, but everyone can apply them to is what's going to work for them from an individual sense. The next symptom I'm going to talk about is movement, balance, and coordination. So there's a video, a YouTube called "This Bike Has MS." It takes a few minutes, so I don't have time to talk about it today. But it's good if you get a chance to just, you know, whack it into YouTube and have a look. It's a really good video about how symptoms can affect people, using the analogy of a bike, and it's a great one. I love to use it. So there's lots of different things in MS that can affect your movements, balance, and coordination, and they can include tremor. Ataxia is when you can't sort of balance, mainly from damage in the cerebellum, giddiness, clumsiness of a limb, lack of coordination, muscle weakness, muscle stiffness, involuntary muscle spasms. So lots of different things can affect people's movement, balance, and coordination. In terms of how we can support people in managing those, or partner with people to do that. In some cases, motion sickness medicine can help with when there's a poor balance problem, but again, I wouldn't say that they are very effective in that. In terms of managing tremor, there are lots of different medications that can be trialled with tremor. It tends to take, again, a bit of trial and error with those medications. And more recently, there's been a group who've been looking for a couple of years, particularly at Royal Melbourne, at using Botox for tremor, particularly in the arm, which in MS intention tremor is the most common problem. And that's when you go to do something, that's when you start to develop a tremor, or when you pick up a cup, that's when you start to do tremor. And that's quite specific, of course, to one limb, rather than generalised, being able to treat generalised tremor. And then there's some rare but not often used surgical options for that. And then in terms of treating spasticity, there's a couple of different options for treating spasticity as well too. If you have that muscle stiffness in your leg, that can often, sometimes that muscle stiffness can help give strength, and so it's a bit of a balancing act between treating the spasticity as well too. In terms of lifestyle interventions, physio, exercise, massage, myotherapy, those things can also, lots of people who went to clinic benefited from myotherapy, and physiotherapy can also be of huge value, and exercise physiotherapists can be of huge value in helping with some of these, not just the stiffness and the weakness, but also can really help with balance. Physiotherapy, there's specialist balance physiotherapists who can do a really great job in doing that. Another really important thing is to have medication reviews, because some of these symptoms, some of these things can be caused or made worse by medications, and it's really important to have those checked out. Bladder and bowel dysfunction. Now, most people with MS tell me they know very well where the toilets are in every single area, and that's because bladder and bowel dysfunction is so common with MS. So in terms of looking at the bladder, there's two different types of symptoms, and they are irritative symptoms. They've got a specific cause, and then most often, bladder symptoms are most often accompanied when there's spinal cord lesions. They're very rare without spinal cord lesions. They can happen, but it's very unusual, and that's because if you look at the brain and spine, most of the work in controlling the bladder is done down at the lower part of the spine. But lesions all the way along the spine, generating down from the pons, which is in the brainstem area, they can cause bladder symptoms as well too. And the most common in MS are urgency, frequency, leakage, incontinence, and they're sort of where the bladder is really irritated. You can see that it's like a muscle, and the muscle is irritated, and that causes that to sort of cause this urgency and frequency and need to go a lot, and their messages to the bladder are distorted between when to empty and when not to empty, and that can cause those sorts of symptoms as well too. And that can come along with what's called obstructive symptoms, so you can have both irritative and obstructive symptoms, which cause us hesitancy, intermittency, straining, reduced flow. So you're sitting on the toilet, start slow flow was common with people. Prolonged voiding, so you had to sit there for a while and it took ages, or double voiding as well too, so that's when you finish and then you have to start again. So lots of different complex symptoms can come up with bladder dysfunction. There's quite a few different options in treating. One of the most common one is what we call on anticholinergics. Anticholinergics very commonly, diptrophan is the most common anticholinergic, and unfortunately can cause constipation and dry mouth. So difficult, because constipation definitely makes bladder function worse in MS. So getting that right, there's other options now becoming more available that aren't in the anticholinergic type of medication, and that's offering people a whole lot of better options. Botox is another thing that's commonly used in bladder function and bladder dysfunction as well too, and can be very, very useful in doing that. And as I said, there's rarely used surgical options as well too. I remember a continence nurse taught me about the 4 Fs, and I thought it was a very useful thing to remember, and that was fluid, fitness, feet, and fibre. And so one of those was to have enough fluid. One of those was to keep fit. Again, exercise has been shown to benefit people with bladder and bowel dysfunction. Fibre was for the bowels, but treating the bowels, also constipation in particular, which is common, helps with bladder function. And then keeping your feet elevated slightly on the toilet. When you're sitting on the toilet, telephone books are things of the past, but a lot of people use little stools, because raising your knees up a little bit actually helps. Just on a little stool actually helps with opening up your pelvic floor. So that can be something that also really, really actually is a little tip, that all these things, as I said, can help a little bit there. And there's another thing called intermittent self-catheterization that can be useful for people with MS as well too. So again, quite a few options there. In terms of bowel dysfunction, there's a couple of different types of bowel dysfunction that can occur, and that's incontinence, which often comes with diarrhea, or constipation, which can also come with a sort of what's called overflow diarrhea as well too. So very common in people with MS, but also very common in the general population, and that's for lots of different reasons. There can be pure neurological damage, which is actually a less common cause than all these other ones in terms of constipation, which is less physical activity. Medication side effects is a huge, probably a little bit unrecognised one, and also poor diet and fluid intake can also contribute to the most common bowel problem, which is constipation. But bowel incontinence is where there's really that's definitely associated with neurological damage, and can also be a real problem. And again, there's quite a few different options, and best done in conjunction with a continence nurse or a urologist. But particularly continence nurses tend to really, and MS nurses too, really have a lot of really good experience in helping understand the causes of constipation, and also really a lot of experience in helping you manage those. So I do encourage anyone who's experiencing those symptoms to be able to get in touch with a continence nurse. So I know I'm going to go a bit over time, but I'll keep going. So for those who see you, for those who have to go, thanks for coming. But neuropathic pain and sensory disturbances are also incredibly common in MS as well too, and something that's it's such a troublesome, difficult thing to treat, and not necessarily pain, but even numbness and tingling. And I really felt for people who experience this. So this picture, whilst it's pretty graphic, to me it really brought home how challenging this can be to live with, and how it takes so much mental work for people to be able to sort of manage these, and so much trial and tribulation with the different medications. So I found, really in my experience, this was the hardest to really be able to kind of be able to support people with, and get something that relieved it, and help people, as I said, mentally as well, sort of be able to live with these different symptoms. Even the numbness in the hands. I saw this sort of people rubbing their hands all the time with MS, and just thought, oh, I wish I could take that away, and I still do, very much so. So there's lots of different types of symptom, lots of different pain symptoms that can occur, or altered sensation, and you can see them there. The trigeminal neuralgia is in the face. Optic neuritis has its own pain, and that's in the eye. Paresthesia is a word that they use for numbness and altered sensation that's often described associated with the limbs, paresthesia of the limbs. And then there's a thing called limits, and that's the one where it happens with lesions that occur in the back of your neck, in your spine, and that's when you bend your head forward and you get little tinglies or electric shocks, either running down your back or running down your shoulders. And all of those, they can be associated with a relapse, and therefore there's treatments that are available, but all add a huge burden onto living with MS. I've never liked the word MS hug, because I've always thought that a hug is a nice thing. It shouldn't be abused by calling something so uncomfortable. But I often described it as, for women particularly, when someone's got your bra and pulled it really tight, and that's common symptom that happens only in conjunction with spinal cord lesions that happen in that area of the spine. But it's common enough to be something that people describe as very uncomfortable, and also bothersome in worrying, because they can feel like they're having a heart attack or something like that. And lots of these things that are mentioned there medications again, and other diseases can also worsen those symptoms. So they're sorts of the things. Infection, gait is just how you walk. All of those things can impact on pain, and pain also impacts all of these as well too. In terms of medication management, I haven't even mentioned all of these, because there's such a big list of things that can be trialled for medication management for pain in particular, but also some of those sensory disturbances. So worth sort of, they often take a bit of upping of the doses and downing of the doses, and so pregabalin, for instance, is Lyrica. For some people that works, for some people it doesn't. So there's a whole different range of medications that are worth considering and thinking about if it's something that you are, that you suffer with MS. And so other things, again, exercise. I know I talk about it a lot, but it is such a valuable thing in help managing symptoms as well too. And as I talked about, again, really getting into those psychological and behavioural things to be able to manage those can be something that's really useful. And I know certainly in the peer groups, lots of people have amazing tips for things like wearing gloves at certain occasions and stuff like that too. So it's worth talking about it with peers as well too, to understand what tips and tricks they've got, because it's certainly, there are many and varied about those. Some people have found a gluten-free diet has helped, others haven't. So sometimes it's something that I would recommend to people, say, hey, give it a try, because just for a short-term period, it might be something worth thinking about because of the bothersome, the real burden of these symptoms. Cognitive dysfunction is another very common one in people with MS. And so the causes of cognitive dysfunction are very complicated. It, again, doesn't necessarily come with, a high disease burden or a low disease burden. And these are some of the common areas that are affected by, in particular in people with MS. Memory is up there in the bright red, but actually executive functioning, or that ability to sort of, be able to think about lots of things at once and process lots of information, is more common cognitive loss in people with MS than memory loss. So there's lots of ways that can affect people, and it's actually the reason for people leaving work the most common early in people with MS is cognitive dysfunction. So there's not a whole lot that can be done in terms of cognitive function. It's worthwhile reviewing medications. It's also really, if you're of the menopausal age, it's also really that significantly impacts cognition. So it's important to consider other conditions that may be going on that may worsen or impact your cognition as well too. So as I said, looking at secondary causes, exercise again has been shown to improve cognition, and cognitive rehabilitation is something that really isn't well studied but has shown some benefit. So I'm still a fan of the big Wordle every day, and getting your brain exercising as well too. This often, all these symptoms often come along with depression and anxiety, and it's commonly associated with people with MS, and in a much higher incidence than in people without MS. Although I did read that in the census data last night that the most common chronic condition now is mental health conditions, which when you think about how common cardiac disease is and heart disease, it's really amazing that it has now trumped all of these other really common conditions as well. So it's very common, and again, but there's still evidence that people with MS are much more likely to have depression than people without MS. So I think in managing depression, there's a medication approach, there's psychology. You need probably to put everything in your basket in terms of how we support people's better well-being, and really important to look at, even for yourself, to understand what's the turning point when things are getting really bad. How do I know when things are going really poorly? There's a lot of great online resources. Beyond Blue has an amazing tools for people to be able to work with that, and there's a UK tool called Act Myself, I think it's called, from MS Trust website in the UK, which also really helps people work through not this major depression, but some of the early signs of depression and getting used to it. So if you want any of those resources, just give us a call via MS Connect. Lots of different treatments for medication for antidepressants, and the list just keeps growing with those. Again, working with either your GP or neurologist, both of them have got some fairly good experience, and they are quite unique. Matching them to the person is something that can be really useful, and some of those medications can also help treat tremor, spasticity, pain, other things as well too. So you can often get sort of, use a treatment. An antidepressant can have the bonus of lots of other helping with other symptoms as well too. And again, I guess, as I said, using resources available to us online, and I think for me, exercise is one of the big things. One of the 5 ways to well-being is exercise, and that's mental health well-being. So, and certainly connections with family and carers, and that's invaluable, as we've all learnt through COVID. So I guess I really whipped through all of that, but I do want to just acknowledge that it is, to get the best ideas, you've got to have a team. And so having a great team around you, and team, I mean the broader sense, peer groups offer a really good opportunity to talk to others and to get them on your team. Neurologist is just one of the team, but having a good nurse can also be, and there's nurses available at MS. With us at MSL to be able to chat through these symptoms. They're really good at it, and so with lots and lots of experience to be able to say, yep, and here's some things that other people have tried, and now let's talk about how it can fit in with you, and what might be right for you and what might not be right for you. So I do encourage everyone to think about how to get their team to support them living with these symptoms as well too. So I've run out of question time, but I will be very happy to, as there's nurses available at MSL to have a chat to you about symptoms. I really encourage people to do it. Sometimes fresh eyes is just a great value. And yeah, and thank you everyone for attending, and any questions we will definitely respond to if you put them in the chat line. And I'll hand back to, well, these are some of the services that I've actually mentioned quite a few of those all the way through, but MS Plus has got some other supports, so physio and OT. We also have those services available for people with MS. And I'll hand back now to Pete.
So I'll just finish by saying a big thank you to Jodi, and thank you everyone for coming. Please do call MS Connect if you have any queries or you want to ask about any services. Thanks very much, and thanks, Jodi.